Hi, I'm Dr. Nicole Vane, and this next video I'd just like to talk briefly about what you can do to help your bone and body heal after a root canal, should you choose to get one. So we do a limited number of root canals here using our laser to disinfect the inside of the tooth, and we refer some out when patients need it to the specialist, depending on the size of the infection or the type of treatment needed. And our specialist also uses a laser, so if there's holistic concerns, he uses ozone as well. But to help your bone heal, as people know, root canals get a really, really bad rap, and that's for a couple of reasons. One, it wasn't done by a qualified technician, where the standard of care is just to do them very quickly, soak the inside of the tooth with bleach, and fill it up with a rubber material. There's often missed canals, missed lateral portals of exit, or they're not evaluating the tooth in 3D and they don't see that they're approaching getting at the infection in the wrong way. So either myself or the specialist is going to pay attention to those details. But getting the infection, a lot of times these are long-term infections, cleared out of the bone. I think what's critical, again, is the D3K2 is going to help the bone fill in. If there is an abscess, it shows up as a shadow on the x-ray, and that means there's a pocket of bacteria that was in your bone, that once the tooth is sealed, that bone will start to fill in. But this will really be helpful. I've also been talking to one of my mentors, Dr. Valerie Cantor, who's a biologic endodontist in Los Angeles, who's also on faculty at UCLA, and she likes to use omega-3 supplement that's not fish oil based, that's algae based. And I can give a link for that as well. I'm also going to try and provide that in the office because she swears by how that helps clear endodontic infections. The other one I really like is the injury rescue. Again, if you're having any tenderness or swelling, this will help clear the inflammation around the tooth and in the bone. A lot of times, obviously, people come in needing a root canal because they're in pain, or after working on it and sealing the tooth, they'll have some pain to biting afterward or swelling, and this can really help with that. The other one is the bacterial infection drops. I find that these are really helpful if there's any residual bacteria, again, to help you avoid needing a antibiotic, because I think antibiotics are very, very harsh to your system. And if you're immunocompromised, it can take years to have your gut health recover from an antibiotic. So a homeopathic remedy is much better for that. The other thing is these turmeric pills are good if you're going to forego using any ibuprofen or Tylenol. Turmeric is a wonderful natural anti-inflammatory. You want to make sure it's of good quality. You can get some really good quality ones at Whole Foods, should you choose. You can't get any of these very easily online. I've tried helping guide people. They're a lot more money online separately than we sell them for here. And if you don't have the procedure done here, you can always come in and pick them up because they're non-prescription. You don't even need to interact with the doctor or have a prescription from me. Of course, I'm here to answer questions, but you can pick them up at any time, and we always stock them here. So that's how I recommend approaching healing from a root canal, whether it's done here or at a specialist's office. If you have any questions, come by the office or watch this video again, and thank you for your time.